Alrighty. Well, good afternoon, everyone. I want to first and foremost thank those of you that are joining us for part two that attended just last week for prioritizing staff well-being, compassion, fatigue, and health centers part one. And I'd also just like to welcome those that are joining us for this part two that were unable to make it for the first session. We are thankful that you all are here and excited to dive into today's session. I just want to set the stage briefly here before I hand it over to our panelists. Today's session is a follow-up, as I had mentioned, to part one. And in part one session, we really spent the time discussing among the panelists the difference between burnout and compassion fatigue and how to begin to recognize those signs and symptoms among your colleagues, friends, and family. And so today, the goal of part two in this follow-up session is to move from awareness of compassion fatigue to action. And so hopefully when you leave today's session, you will feel as though that the panelists have highlighted real-world strategies and interventions that health centers are currently using to reduce compassion fatigue and how you can better build cultures of psychological safety and resilience in your environments and teams. We will also introduce some practical tools such as reflective supervision or peer support and trauma-informed policies, as well as how some leadership practices can prioritize workforce well-being, sustainability, and how we can combat compassion fatigue among our colleagues. Before we dive in today, I would just like to take a moment to reintroduce our panelists. First, I would just like to do a brief introduction of all of them since they are returning from part one. Dr. Bethany Fosu is on with us today. She is a pediatrician and founder of New Life Health Partners Board, certified pediatrician and public health leader, focused specifically on prevention and resilience. So I'll let her go ahead and maybe chime in and just say hello to the team, and then I will introduce Francesca.
Hi, everyone. Good to see those who were with us last time, and nice to meet those who were not with us last time. As Jennifer already said, my name is Bethany Fosu, and I'm a pediatrician, and I would love to know who we have in the room here. So if you feel comfortable using the chat function, please drop your title, possibly, of what you do or your role in your respective organizations. And I would love to just get a feel of, give me a yes or no in the chat. Does your organization currently have any programs or any resources around compassion, fatigue, or well-being? So again, nice to meet you. Looking forward to the discussion.
Great. Thank you so much, Dr. Fosu. Next, I'll introduce Francesca Viola Hamilton. She is owner of FVH Counseling, LLC, where she provides therapeutic counseling, clinical supervision, and consultation to clinicians across New Jersey, New York, Connecticut, and Pennsylvania. So Francesca, thank you for joining us. And I'll hand it over to you for just a moment to say hello.
Thank you. Hi, everybody. Welcome back for those of you who were here last time, and hello to all the new people. I'm looking forward to having a really great discussion. I'm hoping that you guys have come prepared with a couple questions that hopefully we can answer for you. Thanks for being here.
Thank you, Francesca. And lastly, we have Michelle Newman. She's founder of the New Mid Agency and executive coach and leadership consultant. So, Michelle, thank you again for joining us today, and I'll allow you to introduce yourself as well.
Thank you, Jennifer. And I just want to say hello, everyone. So glad that you are here. For those who are listening to this on recording, I really hope we're able to enlighten you and give you some real tools to take away from this that will hopefully enhance your lives and at work and personally as well. And if you guys are able to, I'd actually love to know, for those who are here right now, where are you from? I'm actually from Phoenix, and we just had 90 degrees today, a month early. So if you are able to, you might only be able to be listening, but I'd love to know where you guys are from.
Thank you, Michelle. I think a good handful of us on this call are likely envious of that weather right now in the sunshine. So thank you for sharing that. Thank you, all three of you, for joining us again for this part two of this series. It'll be very similar to how we approached part one. I'm going to propose a question to each of the panelists, and certainly any of them are welcome to chime in after the first panelist has answered the question. If anybody has any questions that they would like to ask the panelists, please feel free to place those in the chat or in the Q&A. We will leave time at the end of today's session to answer any participant questions as well. So with that said, we will go ahead and dive on in. I am going to start with Dr. Fosu. The first question is, what are 1 to 2 practical strategies you've seen work to reduce compassion fatigue or support team resilience in health centers?
For any organization to tackle this topic, which is a long-term solution necessary to make it to make your staff feel like they're supported for compassion fatigue, it first takes, and this is the biggest one, it takes leadership involvement. This type of support and resources is absolutely necessary that it starts from the top to go down to the bottom, because that is where we get the most example, the most buy-in, and the most long-lasting changes, where we have leadership who are also involved with the wellness and with resilience for their staff members. So the programs that I've seen work best are those that are initiated by leadership to ask their staff to create it. So it's not that the leadership is creating it on their own. It requires both. And so the leadership are the ones who are driving the decision to align with the staff members, but they're letting the staff members just drive the solutions. And it creates this very much bi-directional movement of needs and needs being met. So that is my first thing that I would say. It has to start with leadership wanting to move the needle forward. For those organizations that don't have leadership buy-in, it doesn't mean that it's not possible. It just does mean that our healthcare providers who are actually on the ground doing the work, it does mean that they have to go up to leadership and start making their voices known to say, this is what we need and this is why. But it definitely takes both parties, our leadership and those who are healthcare providers on the ground.
Great. Thank you, Dr. Fosu. And I'll leave it open just for a moment if either Francesca or Michelle, you would like to chime in on that before we transition to the second question.
I couldn't agree more. Obviously, like, it's really hard to do something if you don't have leadership that's supporting you and you don't have that type of buy-in. But as an individual, I think it's important to also be aware where you're at and to have your own awareness, responsibility, purpose, because one person can make a big difference. So it is interesting in this conversation. And Dr. Bethany had asked earlier what position you guys are in, because it will help the conversation to know do we have leadership on here, or do we have, non-leaders that are individuals that are working in the workforce, because being able to specifically talk to both or specifically talk to leaders is kind of one conversation. And so that's just my thought process. We can talk about it sort of both ways, but everything trickles down, right? It starts with leadership, it trickles down. But like you were saying, Dr. Bethany, if you're an individual and you see something and you really want to make a difference, you can speak up and talk to your leadership. It's important that you do that. It's important that you realize, wait, my team, our team, myself, we're having compassion fatigue. We need to talk about, this is a signal to talk about our systems. This is a signal that we need to have some type of program that we can implement to make these changes. I love it if a leader notices that and wants to make those changes, but it can also take an employee, someone, who can raise their hand.
Yeah, thank you, Michelle. Oh, I'm sorry. Go ahead, Francesca, if you were going to chime in.
No, and I was just going to say, if there are already existing structures within your programs, maybe there are staff meetings or consultation teams or anything like that, that might be a good place to start, because the structure already exists and you can advocate for adding this in as part of that structure. And it can sometimes sort of, ease that sort of request to leadership so that it doesn't feel like we're now taking on this big undertaking. Now we're asking for the time and the space to really start having these discussions in already existing programs.
And I wanted to define leadership a little bit more too, because sometimes when we think leadership, we think the CEO of the organization or the CMO of the organization. And leadership does not necessarily mean that far removed, right? If that is possible, that's awesome. But sometimes leadership just means the supervisor to you, or it means the person who is responsible for provider scheduling. Leadership really can be a local leadership, which I really do advocate for that local leadership involvement as the main leadership involvement, because that is where the traction is moved. So I'm glad that came up so that we can kind of define what leadership means a little bit more.
Great. Thank you, Dr. Foster. I really appreciate the discussion around defining leadership. I also think it's very important. And we all know that creating an environment lands on each and every individual, right, in that space to communicate and work together to address these issues. And so, Francesca, you had mentioned a little bit about structure. And I want to kind of jump back over to this and ask you this question, since I think it is a good follow-up. What does it look like when a health center creates an environment that supports staff well-being and psychological safety? What are some of those components of a structure that would support that?
I think it's something one that when you walk into a space, you can immediately tell that there is safety to be found here, right? People are speaking with one another, people are interacting with one another. You don't feel necessarily that sort of heaviness that sometimes you'll feel when you're walking into a space that doesn't feel safe. I think that when we're thinking about that structure, and if we are implementing some of these ideas around open communication, that would be the first part, right? Where there is a sense that people can come into the space and say, I'm struggling with this thing right now, or I think I may have done something that isn't so great and I need some guidance, right? Like there doesn't feel like there is this sense of like anxiety around seeking help. And then that, going back to the concept around what the leadership is doing, right? Supervisors, right? Those are sort of like the first level of leadership that we see in most organizations, right? And it's their use of the language around checking in with people, right? Like we're not just focusing on task completion now, but we're really asking questions around like, how are you doing today? I know that you had this appointment, how did that go? How did you handle it? There's more ownership at that level of making sure that our staff are not just doing the work, but rather also managing the emotional aspect of it better. And then, open acknowledgement of how hard this is, right? Like we may not be able to change all of the things, but I think the last time we met, Dr. Bethany mentioned like being able to walk out of an appointment and say, wow, that was really tough. Like being able to just openly acknowledge that this is hard goes a long way to supporting your staff, right? Because they're like, okay, at least there is an acknowledgement here. We're not the only one in the trenches. People are understanding that this work is tough.
And I think to go along with that, it's feeling like you're heard, like someone's listening to you. And that's something a supervisor can really help build a great culture with where they're at, a really positive community, is just someone feeling that they can talk to someone and that they actually listen. And I like what you said before, how it's not just about tasks. Like, okay, did you get X, Y, and Z done? But like, no, how are you doing? And feeling heard is, I think, really valuable.
And I also like the idea of putting in those debriefs. We mentioned in between patients, but which is like our simple task, our day-to-day task of putting in a quick debrief when you walk out of a patient's room. And and also using that community around you. Medicine is not a practice of individualism, that it's just not meant that way. So we use those people who are having those shared experiences with us, because those are the people who will understand the best. When we come out and say that was difficult, we won't be looked at as stigmatized, like that should be hard for you. You're a healthcare provider. But when we're talking amongst our peers who are in that work with us, they understand that when we mean it was difficult, it could be a spectrum of conversation, and it can open up a conversation. I've even seen in organizations where you particularly debrief after deviations from norms. For whatever reason, you're deviating from a norm, rather that be or sometimes not even a deviation from the norm, but is recognizing that, yeah, we might call 911 for emergency care often from this space, but that's not quite normal life. That's not how most humans go through a day. So just be able to debrief about, okay, we had to call 911 for that patient. How are you doing with this? Not only what was the turnaround time for 911? Not only did that patient get everything they need to be transported and continuity of care, but okay, you provider who led this, or you support staff who was involved with this, how are you feeling right now afterwards? And let's check back in tomorrow, 24 hours later, when you've had a chance to go home and really think about it. We can come back again and say, is there anything else that we need to address from that? And that's the good use of huddles and debriefing time.
I love that, Dr. Fosu. And Michelle, you brought up a great point as well. It's just that idea of feeling heard, right? That someone is recognizing what you are going through or what your day looks like, your day-to-day looks like, and giving you that time or that space to be able to express that, and using huddles, like you said, Dr. Fosu. Michelle, I'd like to pose this question over to you, since you kind of kicked off a little bit about that, that idea of being heard. For health centers just beginning to address compassion fatigue, really, where should they start? If it is about just that basic first step of hearing your colleagues and your practitioners in the office space, where do you start, and what's one small change that can make a really big difference in a health center space?
It's interesting to think about the leader setting the tone, because they really set the nervous system tone of each individual and their unit, like what they're overlooking. And so having a calm leadership really reduces the collective anxiety. And it's not about softness or soft skills. It's just about having this calm confidence and really being able to be aware of what's going on and knowing what's happening so that you can respond to things quickly and not let it fester. And I think some of the things that aren't talked about, or you don't have your debriefs, those kinds of things can build and build and build. And that's when you really kind of hit the fatigue, the compassion fatigue. So I think it's important to build a community of safety, as we were saying earlier, the ability to be able to talk and feel heard, and the ability to just have a calm, collective environment. I think that alone will make a huge difference.
And just thinking about that as well, in terms of like, now how do we apply that to all of the other things that we've mentioned? And also using that time to really talk with your staff about what it's like for them, and what are some ideas that they might have of things that might actually help. And then starting small, one very small visible change, and whatever seems the most reasonable and can actually be implemented rather quickly. If you're able to have that kind of conversation, those changes come along pretty fast.
These are all great points. And I think we've talked a lot about communication and supportive supervision and what it really looks like to have that reflective time and space. Dr. Fosu, just going to ask you this question, and of course, the rest of the team can chime in, but really, what are some trauma-informed policies specifically that health centers can actually move on today or in the coming weeks that will help impact workforce resilience, not just necessarily the compassion fatigue, but overall the resilience of the entire team.
Mm-hmm. I think the first step to that is to identify if your organization has any trauma-informed policies in existence at all. And sometimes we have to take a step even further back. Before we can create policies around trauma, we have to be able to identify trauma and define trauma. And so often before we can get to a place where we're developing resources around a specific area, particularly staff well-being or compassion fatigue, we have to go back to the basics of learning what this is. And once we are educating ourselves as anyone in this spectrum of the organization, whether we be from healthcare providers working on the ground or whether we're talking about top CMO leadership, once we start there, I think your policies have to start with educating and making this awareness easy. That has to be the very first step before we can move forward into the next level of policies.
I also think having defined boundaries is important. You have to have defined boundaries, what your after hours are. After hours communication, that's important because it can just continue. I also think having predictable schedules is extremely important. Knowing what your schedule is, and you can you have a life, which is important, and just have a clear pathway forward when there is trauma. Like, again, I bring in a calm, confident leader who knows how to step in, who knows what's going on, who doesn't let things fester. Having that pathway, I think, is really important. And then also, we haven't talked about this, but also having a zero tolerance policy for any bullying or bad behavior, just a zero policy on that. And again, that takes people that takes supervisors and leadership knowing what's going on. All of those kinds of things, I think, are extremely helpful. And if there are any supervisors in here, I also think it's important to know that you have the right people in the right positions. Because if you have someone in a position that they really shouldn't be in, it's going to affect everybody. And that they themselves will be frustrated and know they're not in the right position. And that can cause other types of issues. So I think all of those things together, everything we've been talking about, can really sort of help elevate our systems.
Thank you, Michelle. I think you made a great point of sometimes when we're trying to tackle these larger issues, we're really thinking outside the box. So we're trying to come up with this grandiose plan to address it, when in actuality, there can be very simple policies, right? Like a zero tolerance policy around bullying that can be in place to help work through some of these challenges. I do want to pause for just a moment and just let the audience know that we have a few moments left. So if there are questions that you have, please do feel free to put them in the chat. Or if you are a part of a health center that already has a policy in place or is working towards addressing workforce resilience and compassion fatigue, please feel free to place that in the chat as well and share that with your peers and colleagues so we can all learn from each other. There is one question in the chat that I would like to pose to the panel, and I'll let Francesca go first on answering this one. Where can healthcare workers find resources on building compassion fatigue in the workplace? And if you don't have that answer too, I can pass it on, but I wanted to make sure you got a chance to chime in.
No, so I know of at least one organization right now. It's called the Compassion Fatigue Awareness Project, and it's a nonprofit. And they do have like a website that has a lot of really great ideas on how to identify, manage, and address compassion fatigue, including educational materials, organizational lists, training information, things like that. I think it is geared more towards people in more direct contact, like maybe caregivers. But I've gone on the website myself, and it does have a lot of things that can be applied in a wider area. A lot of times this might be a conversation to have with HR. A lot of HR specialists have backgrounds in doing some level of wellness management for companies, and they may bring with them some ideas that might be applicable to the setting. And then, I think that there are, obviously most healthcare settings have EAP as an option. That's really good, especially if there are just things coming up that fall outside of what can be managed effectively within the program.
I would also add your medical societies, particularly American Medical Association (AMA) and the American Academy of Pediatrics. They About every medical society has some targeted information and resources, even our nursing associations, around these topics related to well-being and compassion fatigue. Another very great resource, if your organization is in a community that is connected to an academic center, typically an academic center that has some type of medical student or medical residency or nursing students, medical professionals who are at academic institutions. Those academic institutions tend to have some very peer-reviewed and academic focused resources around this topic. Because as we're raising up new healthcare leaders, we want to make sure that they have this as a core. And so you'll find different ways that people communicate this, but Johns Hopkins has like a Joy in Medicine program also that focuses on these types of topics.
I want to say thank you to all three of our fantastic panelists. Thank you so much for your time over the last 2 weeks. We really started this discussion by defining compassion fatigue and differentiating that from burnout specifically, because often they are tossed into the same bucket, and then transitioned beautifully today into some action items and how you can transition from that awareness into policy and creating healthier spaces. So thank you so much for your guys' insight and fruitful discussion on that. So with that, I'm going to go ahead and tell everybody thank you so much for attending. I hope you have a wonderful day. And thank you again to all three of our panelists. We hope everybody take care, and we'll see you soon on another training. Thank you.